Here is a short video explaining about the planning for a procedure. Most of the times we think procedure is all about the technique, going in and doing the procedure. But we will realize that planning plays an important role. So please watch this video to understand how to plan for portal vein stenting. So this is about a 9-month-old child who had a living donor liver transplantation in 2014 for neonatal cholestasis because of a bile synthetic defect. And subsequently, child had rec shunt in 2017 for portal thrombosis causing portal hypertension. Now the child presents with raised bilirubin and some features of portal hypertension and patient has been referred for portal vein stenting because of the stenosis of the rec shunt. So the most important thing to remember here is the planning. So prior to any procedure, it is very important we plan. And in this patient, if you see, the sagittal view gives a best view of the portal vein narrowing, as you could see on this particular image. The next important thing is the sizing of the stent. Usually we measure the SMV and it measured around 8.5 mm. So we can choose to go for a stent which is about 10 mm, this being a vein. So you calculate the size of the stent by looking at the SMV. And the other thing that we need to do is looking at the portal vein which needs to be punctured. Now we have segment 2 and segment 3 portal vein, but which portal vein needs to be punctured is something that you need to assess from CT scan and also from ultrasound. On this you can see that the portal vein, this is probably the shallowest portal vein from the skin. And it's less than 4 centimeters from the skin surface. And we choose this portal vein because it is extending quite peripherally, and you need to have that much length of the portal vein for the wire to traverse and for you to negotiate into the narrow segment. So always choose and puncture the portal vein quite peripherally. The next thing that you must check is the angulation. Now, if you see, if I puncture this particular portal vein, which is quite shallow from the skin, it has got an angle of about 90 degrees to enter the stenotic segment. Now, can I have any other vein wherein the angle is not, so acute like that? But is it worth looking for another portal vein wherein the angulation is not too acute for me to negotiate? So this is something that we need to look at before we actually go in and puncture the portal vein. Now this is the other portal vein with a little bit of a better angle. However, I chose to puncture the segment 3 portal vein because it's longer and it extends quite peripherally. So I can puncture the portal vein quite peripherally if I choose the segment 3. So these are all the things that you need to assess before you actually go in and puncture the portal vein for any procedure.